Good afternoon, students. Welcome in HCP lecture. Today's I will start the lecture of the hospital and clinical pharmacy. Chapter number 5, Physiological parameters. Let us firstly shortly look at the what we saw in the previous lecture. Okay. Definition. Then hematological parameters, RBC count and WBC. In RBC count, firstly definition, physiological parameters can be defined as gauges used to check normal physiological form of organ or organelle system. In hematological parameters, RBC count and WBC. Okay. And thrombocytes. In RBC count, normal value of the RBCs in human bloods: male 5 millions per CUMM, female 4 to 4.5 millions per CUMM, fetus 8 millions per CUMM. Then significance. In RBC count, packed call volume or hematocrit. Then mean corpuscular volume, that is MCV. Then hemoglobin, that is HB. Then color index. Then next ESR, erythrocyte sedimentation rate. Then next is in ESR advantages, then significance and example. Then next is WBC, that is white blood cells and leukocytes. In that WBC, the normal value of the WBCs, adult, children, infants and newborn. Then significance of WBC. Then DLC count. Then significance. Okay. In next is thrombocytes. In thrombocytes, significance and clotting time significance. Okay. Now see, the next point of today's lecture is biochemical parameters. In biochemical parameters, 4 biochemical parameters: blood sugar, blood cholesterol, and lipid profile, and serum enzyme. Now first is blood sugar. The blood contains a certain amount of the sugar to provide energy to the body to perform various functions. In blood contains the certain amount of sugar to provide energy to the body to perform the various functions. The normal fasting food sugar level is ranging from 18 to 120 mg%. If blood sugar level falls below the 74 or 15 mg%, the symptoms of hypoglycemia appears. If blood sugar level falls below the 70 to 50 mg%, the symptoms of the hypoglycemia appears, and increase the level is known as the hyperglycemia. Okay. What is the hyperglycemia? The blood contains a certain amount of the sugar to provide the energy to the body to perform various functions. The normal fasting blood sugar level is ranging from 80 to 120 mg%. If blood sugar level falls below the 70 or 50 mg%, then symptoms of the hyperglycemia appears, and increases the level is known as hyperglycemia. Then significance of blood sugar. The increased level of blood sugar is indicative of diabetes, severe nephritis, hepatic and pancreatic disorders, then hyperthyroidism, etc. Significance: the increased level of blood sugar is indicative of diabetes, severe nephritis, hepatic and pancreatic disorder, and hyperthyroidism, etc. Okay. Then blood cholesterol. Blood cholesterol level measurement comprises an important test for that patient suffering from cardiovascular disease. The normal value of blood cholesterol is 120 to 140 mg percent. It is directly related with aging and reaches 280 to 300 mg among 70 years old people. What? The blood cholesterol level measurement comprises an important test for that patient suffering from cardiovascular disease. The normal value of blood cholesterol is 120 to 240 mg percent. It is the directly related with aging and reaches 280 to 300 mg among 70 years old people. Then significance of blood cholesterol is present in the following form: LDL cholesterol and HDL cholesterol. It means low density. LDL cholesterol means low density lipoprotein cholesterol, 60 to 80% of total cholesterol. Then HDL cholesterol means high density lipoprotein cholesterol, 25 to 40% of total cholesterol. Then cholesterol level mg percent and disease, 80 to 100% mg percent, that is disease pernicious anemia and hyperthyroidism. Then 300 to 400 coronary disease like atherosclerosis. Then 400 to 500 disease is diabetes. Then 500 to 600 then obstructive jaundice, and above 60 cholesterol level mg percent, then disease is nephrosis. Okay. Then next point is lipid profile. In lipid profile, the patient who are the high risk of cardiovascular diseases, essentially to know the status of level of lipid profile, which consists the measurement of cholesterol, then triglycerides, low and high density lipoproteins, and risk ratios such as cholesterol, HDL and LDL as to HDL. Okay. Lipid profile is the patient who are the high risk of the cardiovascular disorders, essentially to know the status of level of lipid profile, which consists of the measurement of cholesterols, triglycerides, low and high density lipoproteins, and risk ratios such as the cholesterol as to HDL and LDL as to HDL. Okay. Then estimation and normal value. Serum total cholesterol normal value is 120 to 240 mg percent. Then serum triglycerides normal value is 60 to 165 mg percent. Then serum HDL normal value is 30 to 90% mg percent. Then serum LDL is normal value 80 to 150 mg percent. Then serum VLDL, that is normal value up to the 35 mg percent. Then risk ratio cholesterol as to HDL is 3 to 6. Then LDL as to HDL is up to the 3.5. Okay. Then significance of lipid profile is in alcoholic cirrhosis. In alcoholic cirrhosis, the lipid profile remains on higher side. Then the LDL value is found to be higher in case of atherosclerosis, impaired glucose tolerance, and acute relapsing pancreatitis. Okay. Then triglycerides level increases in the hyperthyroidism and CHD. Then LDL as to the HDL ratio increases in the diabetes. Okay. First significance is in alcoholic cirrhosis, the lipid profile remain on the high side. Okay. In alcoholic cirrhosis, the lipid profile remain on the higher side. The LDL value is found to be higher in case of the atherosclerosis, impaired glucose tolerance, and acute relapsing pancreatitis. Okay, then triglyceride level increases in the hyperthyroidism and CHD. Then LDL as to the HDL ratio increases in the diabetes. Then next point is serum enzyme. In serum enzyme, it is also important guess to diagnose few diseases. Deposit the presence of enzyme in functional amounts. They may release in the large amount on tissue damage. Some of the enzymes are enzymes and the chart of the enzymes and normal value. The enzyme of creatine phosphokinase. The normal value is men 20 to 50 IU and women 10 to 37 IU. Okay. In lactic acid dehydrogenase 70 to 40 IU. Then alkaline phosphatase adult 29 to 92 IU. Then children 19 to 220 IU. Then aspirate transaminase. Then men 0 to 40 IU and women 0 to 30 IU. Then alanine transaminase 5 to 35 IU. Okay. These are the biochemical parameters. First, blood sugar. Second, blood cholesterol. Third, lipid profile. And last is serum enzyme. Okay. Now I will I will stop here. Thank you.